Hello, everyone, and welcome to our Oregon Eligibility Ongoing Learning Series, also known as One Learning, One Webinars, and other things that I end up calling it that might not be on brand. My name is Jessica Diaz. I work for the Community Partner Outreach Program as a provider outreach and engagement strategist working statewide. And I will be one of two hosts and presenters that we have today. Liliana, can I ask you to introduce yourself next?
Of course. My name is Liliana Palomino, and I work with Jessica on the Healthier Oregon work, including we have Jorge, Monica, and Maria Vargas that also work on this. And I'm very happy to be here, and hopefully we're able to answer all the questions you may have.
Thank you so much. And we are here today to talk about Healthier Oregon. And so it's going to be a little different today than our other learning series have gone. We have a lot of great content. We also have a lot of other folks who are supporting us. I think if it's all right, I'd like us to stick with the presenters introducing themselves right now. And then as questions, comments, things come up where folks want to chime in, we please give your name and your position when we first hear from you, just as a way to sort of streamline that a little bit. And so we have some pretty straightforward objectives today. We're going to talk about Healthier Oregon as a program. What is it? Go on to what to expect as it launches in the very near future. Talk about some communications and other work that's been done and we have in the works coming from the state. Talk about the community partner role and support specifically. And then we want to hear from you about what we can do to support this work, to support you all to feel like you have what you need to be successful as a few things change with the Oregon Health Plan. Starting out with some background, Healthier Oregon was originally called Cover All People and was part of House Bill 3352 that passed last year, 2021, in the Oregon legislature, and it expands full OHP benefits to more people. This means that beginning July 1, 2022, more adults will be eligible for full Oregon Health Plan and other medical assistance benefits, regardless of their immigration status. We were given a limited budget, which means that we can't extend OHP benefits to everyone, regardless of their immigration status. A community advisory work group convened and helped to guide decisions for this program. This group is made up of half folks with lived OHP or CALM experience, and they have been advising us on a range of things, but the big first order of business was to find ways to expand coverage while meeting our budget limitations. And their recommendation was that we first start with people who are ages 19 to 25 or 55 and older, are currently ineligible for full OHP because of their immigration status, and meet all other OHP eligibility requirements. And some of those pieces are from the work group and some of those pieces are built into law about how exactly we parsed this population. So what does that mean as we get into program start July 1? This means that people who are 19 to 25 or are 55 and older who are currently enrolled in either CALM or CALM Plus will automatically move to full OHP benefits starting July 1, 2022. The plan is for them to begin as open card and then transition on to coordinated care organizations, just like anyone else who is newly CCO eligible. So they will show up for CCOs, and we will talk a little bit more about that timeline in a slide coming up. We expect this to be about 12,000 people who are making this transition from CALM or CALM Plus to full OHP. Also, people who are in those same age ranges of 19 to 25 or 55 and older who currently are not eligible for OHP because of their immigration status, but maybe are not interacting with OHP systems in any way. So they're not on COWAM, they do not have benefits. They can apply and may be eligible for full OHP benefits starting July 1. And this is not a special application process. This is not anything different than applying for OHP. Our systems will be updated so that that will be something that we will take everything, run it through our rules engine, and people, because of Healthier Oregon, who in the past would maybe only get CALM, or maybe even for programs that didn't have CALM, not have benefits, could potentially be eligible for full OHP. Now, we've been talking about the specific age groups that were included in this first year of Healthier Oregon, but I do want to talk a little bit about people who are 26 to 54 who don't qualify for full OHP because of their immigration status. Um, so people who meet the other eligibility requirements will still be eligible for CALM or CALM Plus coverage. And to talk briefly about CALM, which is Citizenship Waived Medical, it covers emergency care, like what you get in a hospital, and also includes other services. So if we want to call out, some of this is a couple years old, some of this is brand new this year. There are certain reproductive health services, outpatient dialysis and end-stage renal disease care, cancer, and behavioral health crisis. So some of these things might be very new to you hearing with a CALM lens, and we will be talking about that more on another day. But just know that as of 2022, there are additional things that CALM can cover. It is still emergency care, but it has a slightly growing definition of what that emergency is. And I plan to use a provider webinar to talk more about that. So now I'll just put in a quick teaser for more content to come in another setting. And then just as a reminder, CALM Plus covers full OHP benefits during pregnancy and for 60 days after the pregnancy ends. So the major difference someone might be experiencing if they are under 26 versus over 26 is the fact that CALM Plus outside of the public health emergency does have that end date that then converts back down to CALM, or potentially not coverage if it's above the CALM income level. So I want to talk very high level about eligibility for this program because it is inclusive of both MAGI and non-MAGI programs, which makes it different from Cover All Kids, which is the program that came before. It includes even long-term care. So this means that if someone does qualify for or potentially qualifies for a non-MAGI program, they will have those same responsibilities and requirements as other people being considered for OHP Plus, which could mean an interview. It does mean that resources and assets have to be shared. So there are some different experiences folks may have if they have not interacted with our non-MAGI systems before. And they might not have interacted with any of our systems before. So I just want you to understand that this is bigger than only our sort of traditional MAGI income-based OHP, which is exciting, but does make it a little more complicated. And then to talk a little bit more about that initial CCO enrollment time for the folks who are transitioning, here's what we expect to happen. On July 1, CAL members who are ages 19 to 25 and 55 plus automatically transition into Healthier Oregon programs to get full OHP Plus via ODHS system mass update. So that means that the one system and all the other attendance systems related to its work will run a mass update, and all of those folks will get updated notices, updated eligibility, and start the process to get them onto a CCO. They will start as fee-for-service, and then on July 11th, we expect, that's when that weekly batch will run that gives CCOs their new member information so that they will be seeing these members and their information for the first time. Until August 31st, members who are in places where there's more than one CCO can change their CCOs. They will be auto-assigned at first, but they are able to change. And then all the other times that people can generally change CCOs applies to this population as well. There's just this first few months is a time where just people, you all should know that you can help people change CCOs without having to meet any other qualifications. And I think one thing that is specific to the community partner role and this population is not that people are going to have different benefits from what you're used to talking about, but the idea that these members, for some of them, this may be the first time they've ever been able to have full medical benefits. There's going to be a whole range of system familiarity, experiences that are good or bad with our systems, system and systemic trauma, a lot of historical, cultural, linguistic barriers and inequities that this population has faced. And so there's a really big difference between us flipping a switch in the system and giving people coverage and us providing meaningful access to people. And that's something that I think is really central to our work as community partners, that we can bring to this specific program and this specific change. And I'm going to hand it off to Liliana for the next part.
Thank you. So part of our communication goals is to make sure that all of our community partners in our network and providers and other staff know how we can support Healthier Oregon members, know what's happening, and know how to support their work. So we want to make sure that through all of this, you all know how what's going on with the program and how we can best support the work that you all are doing. Next slide. This is an outline of some of the outreach and communication that has already been done or is being created as we speak. So we have a website for Healthier Oregon, an FAQ document that's being created, as well as we're hoping to get some questions you may have and if possible, add them to the FAQ document. We have an awareness flyer for CAWA members. We will have social media videos and graphics, letters and phone calls for CAWA members. Soon to be Healthier Oregon members will be happening during the next couple of months to let them know about their OHP benefits. Sorry, my little GoToWebinar box is covering the slide. As well as we will have a grant program to continue the work and help support the Healthier Oregon members with healthcare navigation. If you want to go to the next slide. Perfect. So this is the image of what the Healthier Oregon website looks like. We have the links here, and I'm going to share my screen. So just give me 1 second. And we want to share, well, we'll start with group site. Can you see my group site screen?
Yes.
Okay. Can you see the Healthier Oregon screen yet?
Yes.
Oh, perfect. All right. So here is the Healthier Oregon website that we have, and it is available in Spanish as well. So you can see the information in Spanish. Go back to English. Oh, there we, there we go. It gives you more information about the timeline of when certain work has been done from when the legislation was passed all the way to when the eligibility and full benefits begin for new members, an explanation of eligibility. And you also will find frequently asked questions. So if there's questions that you have about Healthier Oregon, you may find the question here, as well as an FAQ that we will be working on to provide to community partners. And then let me get back to the slides. Here is the flyer. It is available in the top 10 languages. Electronic copies are available via group site. And Jessica, I was navigating group site. Are the flyers already up on group site?
Yeah, so if you go to group site, I believe that Maria Vargas did an announcement where she linked to.
Yeah, let me get us to my group site page.
Yeah, we have linked to the
There
flyers.
we
They
go.
aren't uploaded into group site because we want to make sure, if any version control happens.
Yes. So here is the communication that Maria Vargas sent earlier this week or 9 days ago. And it has more information. It talks about the flyers. It also has a link where you can see the letters that were mailed out to members, and there are multiple languages. And I'm not seeing,
The
let me see if
flyers are in
Maria's
that same link as the
in
mail.
that same. Okay, so
Yes.
this one.
Click the here. It's
Perfect.
many links.
Awesome. Can you see the Healthier Oregon mailing flyers?
Yes.
Oh, perfect. So here is links to the sample letter that was sent to members, that is going to be sent to members. And then down, if you scroll down, you have the flyers. It's loading. Sorry, my computer's a little slow. So you have the flyers here that you can use for printing out to give to members, as well as adding it to your social media platforms. And if there is, I know that the regional outreach coordinators have asked if you are interested in printed flyers, so letting your regional outreach coordinators know if you would like printed flyers of Healthier Oregon. And I'll put this link in the chat box. Let me go back and put this link into the chat box. One second. Perfect. There. The link, that link should lead you to this document. Now let me go back to the presentation. And like I mentioned previously, the letters and phone calls to CAWA members are starting. The mailing date for the letters was May 16th of this year. It was translated into the members' preferred languages, a total of 35 languages. Letters were sent to about 12,000 CAWA members and CAWA Plus members. Follow-up calls from state will begin in June. So we will be calling, the state will be calling CAWA members to let them know about their changes to coverage. Here is an example of what the letter looks like that was mailed to members. And you can also, in the link that I provided, you can see the letters in different languages. So if you have Healthier Oregon members that contact you about a letter, this is the letter that they're talking about that they received. We value so much the work that you as community partners do, and for the work that you all do for healthier, for all OHP members. About 44% of the members are already associated to our community partners, which is amazing. That just shows the commitment to community that our community partners have had in working and making sure that COWA members and COWA Plus members have access to healthcare in some capacity. The inreach that we're asking and we're hoping is that you all work with the healthier members within your organization that you've helped, and letting them know that they now have full OHP benefits, and then doing outreach. So if you have new eligible Healthier Oregon members that may have questions about what having full OHP coverage means, being able to explain to them and provide them the information that they need at that point in time. As well as we have ongoing training opportunities that we would like to provide you all, so keeping up to date. Another important part, and this is one of my favorite reminders to give during trainings, is check group site. A lot of these updates are going to be on group site. A lot of these flyers or information is going to be on group site. So if you have any questions or are looking for materials, check group site. And if not, let your regional outreach coordinator know that you have any questions or need any support with supporting the Healthier Oregon members within your organization. We are also going to be launching in a grant program. The grantees will be focusing on healthcare navigation, making sure that the new members have an understanding and know how, how to utilize their OHP benefits. All Healthier Oregon grantee partners will be trained or supported to do CHW work as part of the grant at CHW Community Health Worker work. And we have some questions, some common questions, and I'm going to pass it on to Jessica.
Yeah. All right. We're here to dig into a couple weeds. One of which is the question, does OHP affect immigration status? And how does Healthier Oregon interact with public charge? And we have an answer, which is that it's almost always not going to affect it. And I'm going to talk very briefly about the one situation where it might, which is that there is one situation in two settings that could be considered for a public charge test. That is, if someone is receiving long-term care in a nursing facility or state hospital. Every single other type of OHP medical benefit and every single other setting where someone may be getting long-term care does not count. And that includes, I just have a few examples. So here are long-term care services that are not considered for public charge. If someone is getting in-home care services, if someone is in adult foster care, if they're in an assisted living facility or residential care facility, specialized living facility, or group care homes. And now all of these different types of long-term care settings are defined by rule, and we can get you more details on that. But I really want to stress that none of the medical benefits outside of long-term care are considered for public charge. Most settings people are receiving long-term care also is not. But if they are in a certified nursing facility or state hospital, there is that possibility. And people with specific questions or concerns should be talking to an immigration lawyer, should talk about their specific situation with someone who is trained to help. But almost all Healthier Oregon and OHP in general does not count for public charge, and I want to say that again and again. Next slide, please. So I saw some questions about the marketplace, and so we do have some information, which is that if someone is currently on a marketplace plan and they receive a notice that states that they've been enrolled in full OHP benefits, they must report this change at healthcare.gov and cancel their marketplace plan. They should do this not with the plan directly. OHP can't cancel the marketplace. It has to be through healthcare.gov. And there is also this phone number we have here that they can call, that 800-318-2596. Now, as soon as someone becomes eligible for full OHP, they cannot get financial help anymore from the marketplace. So they could also keep their marketplace plan, but they will not be able to get any financial help, and they may have to pay back any that has been given. So that is something we want to get a little weedy about because it is an important distinction to talk about. And that is true even in the public health emergency with people staying on coverages that they maybe normally wouldn't. All right, I think that's it for that weed. I'll hand it back.
Perfect. Do you want to answer some questions since the last couple of our slides are about feedback?
I think that's a great plan. I think we can talk about some of these. I know there's a lot, and I have not fully had a chance. We have a whole cadre of folks who are helping us sort these.
So I can start, and if we don't have a response to your question, we'll follow up or we'll add it to the frequently asked questions because some of these questions we're not going to be able to answer completely. So the first question, does this affect their process for applying for permanent residency if they receive OHP benefits?
I'm sorry, repeat that one more time. I got distracted by a very compelling other question I was reading out
No,
loud in my
no, no, no.
mind.
It's okay. Does this affect their process for applying for permanent residency if they receive OHP benefits?
Ah, yes. So that is what we were just talking about, that public charge test. So OHP will not affect that process in any way with that one tiny caveat of very specific facilities where people might be receiving long-term care. Oh, and I did want to add actually, long-term care is one of the only things in our application where you don't automatically get considered for it. There is a specific set of questions about if people need help with daily activities of living, and they must say that yes, they need help, and yes, they would like an assessment in order for that to happen. So people should not accidentally be applying for that if you can help them understand why that question is there.
And I think if members have questions about permanent residency or any type of immigration, that would be referring them to contact an immigration attorney. I want to make sure that those questions get answered and it gets answered by a immigration professional, immigration attorney professional that can answer those questions more in depth because every immigration case is very different. The next question. So those ages 26 and 54 are just on limited service, correct?
So for people who are not in the age ranges for Healthier Oregon, it means that they would be evaluated and given potentially CALM and CALM Plus benefits. So those benefits are staying, well, they are currently expanding, which complicates the conversation a little bit, but they would get emergency only or pregnancy related care and not of the full OHP benefits moving forward at this time.
Can I next question, sorry.
Go
I
for
got
it.
a little excited. Can we request a CCO update for patient/clients by calling the 1-800 number or do the clients need to call themselves?
So when it comes to interacting with the client services unit, and actually, I do want to make a big statement sort of across the board, which is when it comes to this population, your abilities, your role, And a lot of the moving pieces are exactly the same as anyone else on OHP. So all of the things you've been able to do for other cases, you can do for these folks as well if you're associated. And that includes calling client services unit on behalf of someone to help them sort out their CCO situation, calling the one customer service center for any eligibility related updates or changes or things that need to happen. And so I also want to say, because I saw a lot of questions about what exactly is covered, what are the benefits, that's another situation where it's exactly the same as OHP Plus. So the benefits package for someone who is age 19 is exactly the same as anyone else on OHP Plus who is age 19. So that includes things like vision. For a pregnant uh, person, it's going to be that same supplemental pregnancy package. And for an adult, it's going to be the same as the adult package. So we're not going to be able to answer specific questions about exactly like, is this specific procedure covered? But just know it should match exactly that OHP plus level of benefits. Ooh, sorry, that was a long answer when a short one could have sufficed.
Following question. I'm curious, will family members be assigned to the same CCO as the other family members in the household?
I do believe that there is work to align households. I've heard some specifically related to if there's a coverall kids person on the case, then there will be alignment there. So we will do what we can to make sure things are aligned.
And I have a complex question that I know does not have an easy answer. Um, for people who are enrolled in COWAM and then had a change of income that would have made them ineligible if not for the public health emergency, will they receive full benefits until the public emergency ends?
Yeah, let's stop there. And the answer is yes. So while the public health emergency is ongoing, people will continue with their OHP coverage, and this includes the folks who are currently on COWAM but maybe over income for COWAM outside of the public health emergency.
If so, I could imagine that some of these people will, with emergency only benefits, might have enrolled in Marketplace, but would lose access to tax credits once Healthier Oregon takes effect, but only until the public health emergency ends. They would potentially go back to Marketplace or the bridge plan if it's finalized, if the waiver
Hmm.
does provide 2 years of continuous eligibility, they would stay in Healthier Oregon. Oh, so this is just more
Yeah.
context. I thought there was another question.
And I
Sorry.
think that relates to the update I gave about the marketplace too. So even if someone under other circumstances would not be eligible for these benefits, but because they are because of the public health emergency, um, sorry, it's the other side of the marketplace thing I talked about, which is, yeah, they're eligible. If they're eligible, they're eligible, and we're going to continue to give them benefits. And when they are no longer eligible, then it will be their responsibility to find those other solutions. Could be the marketplace, could be all the other, gosh, I don't want to go into the bridge plan today because I know we don't have the time to give that the attention it deserves. Um, but if someone is currently on CALM and transitioned to OHP Plus via Healthier Oregon, it will continue until we get rules that say otherwise. And in that case, it's the public health emergency redeterminations conversation.
So here's the following question. How about clients who come in with a tourist visa?
I am going to give a very unsatisfying answer, which is the to repeat what I've been saying, which is if someone is ineligible for OHP because of their immigration status or because they do not have an immigration status, that is the population that is newly considered for OHP full benefits here. So I am not an expert who can talk about the ins and outs of every single immigration status and which ones were previously OHP plus versus CALM. But just know that that does span a large range of different types of documentation or lack of documentation.
And then how many slots will be available for Healthier Oregon?
We do not have slots. We have $100 million to work with in this first year, and our agencies and the state has affirmed that we are going to make the outlines that we've laid out today work. I did see another question that relates, which is, can we talk a little bit about the funding? And I can talk very briefly about the funding because it's actually written directly into the House Bill 3352, which is it directs us to maximize our federal match. So anything that would be covered under COWAM, we can still send to CMS. We can still get federal match on. And then the rest comes from the state. So it is federal funding, it is state funding, and it is really trying to make the most of all of our funding sources so that we can cover as many people as possible. And then this current law only sets that $100 million for the first year, so we're going to see more things happening in the next year as well.
Thank you. So here's another question. If a Healthier Oregon member turns 26 during the year year-long postpartum period, will their coverage end, or will their full coverage continue the whole year of eligibility?
Oh, there's a lot to unpack here. First off, something that did not make it into our presentation but is important is that while the age group just is 19 to 25, for the first year, if someone turns 26, we are able to keep them on longer. So that is a flexibility we've been granted. There's also the unpacking of Healthier Oregon versus Cowan Plus and the 2 months versus 12 months of pregnancy coverage. And that pregnancy coverage for Healthier Oregon should, oh, I might need to actually double check because there's so many different moving parts in this because it's turning 26. It is the postpartum period, which is different for Cowan Plus versus Healthier Oregon. I believe it'll be protected for that whole first year, but I want to pull the people who know more than me. So I started answering and then realizing I might not have for sure the answer, but we'll get to that and we will get back to you. Great question. Goodness.
Great question for the FAQ as well.
Oh, absolutely.
Should clients cancel Marketplace first, or should they wait until they have OHP?
Great question. No one should proactively cancel their coverage hoping to get another type of coverage until they get confirmation of that. So it's when they receive the notice that shows full OHP benefits is when they have the responsibility to cancel a marketplace plan if someone's on it.
How will OHA and OHP let us know when we've reached the limit?
I don't have an answer to that, but we believe we've built this program within what we are able to fund.
Will we get a list of our Healthier Oregon clients? That's a great question.
Oh boy. Yeah,
Maybe that's a follow-up
let's
question.
talk offline. If anyone's interested in having a more hands-on approach with reaching their Healthier Oregon clientele, Liliana and I would love to talk one-on-one, or I guess
Yes, we would.
two-on-one.
Yes. We have been talking about members that will be auto-transferred. What about people that as soon as they heard about Healthier Oregon, they want to enroll? How soon can we help them?
Yeah. So anyone who is on CALM will be able to transition automatically. So if you are helping people right now get onto column level coverage, that will happen. They can also apply at any time. And once the rules engine is updated, it'll evaluate them for those Healthier Oregon parameters. So the answer is we can help them now and into the future. Just know that for some folks that might mean having CAWM until July 1st.
Has the official media campaign started yet? I've been seeing posts on Facebook about it from organizations that are not usually grantees, but nothing from OHA.
That is a great question. I know, so we talked about the letters and the flyers. I have started to see almost immediately. We published those flyers and I am seeing them out in the wild, which is really cool.
It is
Um,
really cool. I saw the flyer, I think like 4 or 5 times on Facebook already.
which is a great sign that people are really hungry to share this news. Um, Yeah, I'm not sure if we've put anything on the OHA Facebook page yet, but the campaign is underway, but I would say we're in sort of the soft start right now. We are starting to get flyers in electronic and printed formats. We're starting to get the word out. We have more planned for social media for sure. Videos, things like that that are still in the works. And I wish Maria were here because she is the one who is making amazing things happen with our media campaign. She would have more details. So more soon.
If a farm worker who comes to work only 8 months and they come with a work visa, could they apply for OHP benefits?
Yeah, I like Deanna's answer here, which is absolutely anyone can and should apply. And the system is going to sort out what someone may be eligible for. So, yes.
Will the marketplace system recognize the new healthier organ OHP eligibility, or will clients just need to cancel their plan on July 1st?
I think so. I don't think anyone should be canceling a plan on July 1st because they won't have gotten letters from us likely because the mass update happens July 1st. So that's when documents are going into our mailbox to go out. Um, the marketplace system is not going to automatically close or cancel anyone. That is what an individual has to do. But I do want to say again, like people should wait until they get confirmation of their eligibility for full OHP before they take any action on their marketplace plan.
Regarding July 1st mass system update, what do you mean when we say starts fee for service with full benefits?
Great question. So whenever someone newly applies for OHP or newly gets into a type of OHP that has CCO coverage, they always start as fee for service, which is our traditional medical model where a provider does a service and bills the state directly, OHA. And so people start out on that system while CCOs get and arrange and send out their welcome packets and really start doing their hands-on work to do outreach and engagement with their members. So people will start on fee for service just as if they were brand new OHP members. And then those who are eligible for CCOs, and that's going to match OHP members once again. Some people might have other major medical or something that keeps them on fee for service, but most will then roll on to CCOs. I hope that helps.
I think it does. When do you expect to have a deeper dive webinars on the new cancer dialysis for CAWM coverage?
I will say mid-June. Planning it for mid-June. Exact date and time and registration link coming very soon.
Do you have a list with CCO members for county that we will call or send emails when I have a client asking for OHP?
Um,
This
I think here I do have so when someone becomes a CCO member, there is a weekly list that gives CCOs their member information when it happens, not in advance. As far as the community partner role, You are able to work with anyone you're associated with, and we can talk about ways in which we can help you figure out who this population is among your own client base. But as far as, broad lists of members or things like that, that is outside the scope of our role. And then as far as which CCOs people may be eligible for, if that's the other side of this question, then yeah, we have a website with a pretty map. I don't know what word I was gonna put in between that, but it's a nice color coded map with all the CCOs and their regions. And so that can also be a tool you can use when helping people understand their CCO choices. And every CCO has a website, so that can be very useful as well. I hope some part of that answered the question.
And I'm seeing quite a bit of marketplace questions. Will OHP coverage started before the notice to client? If the OHP coverage starts before noticing the client, including the mailing time, if yes, does the client need to pay a premium for marketplace gap?
Oh, what's amazing is the next question is actually an answer to that question, which is the IRS will not expect repayment of tax credits so long as marketplace coverage ends in the same month that OHP notifies you of an approval. So it is safe to wait for the OHA approval first and then term a marketplace plan. Thanks, Sean. That was very helpful to see right next after that question.
And what is considered a behavioral health emergency?
That is definitely something we can't get into today, but we can talk a little bit more about that in an upcoming more deep dive Callum conversation.
So
I see some things that are off.
yeah. um, Eligible, let's say apply. So there is quite a bit of questions about, do we want to go into the questions that are off topic or maybe save those for the next webinar?
I think I want to double down on that the eligibility, everything around eligibility and everything around the benefits that are covered matches other OHP clients. So for instance, there is a question on the application that says, I live in Oregon, and another one that says, I plan to stay in Oregon. We do not ask you to give any specific time requirement. People don't have to have been in Oregon for a certain period of time. They do not have to prove or state that they have a specific amount of time they know they plan to stay in Oregon. If they answer that their intent is to live and stay in Oregon, then we accept that. So it might be a little more complicated with folks that are more transient. But if they answer, yes, they plan to stay in Oregon, yes, they live in Oregon, then that's all we need. We do not need any specific dates for how long someone has been or planned to be in the state. And so that's across all OHP folks, but also applies to this population. Um, Same with like what's covered in their open card benefits versus their CCO benefits. It should match what other OHP plus folks are experiencing exactly. Um, and I think for the marketplace related questions, maybe we want to do a follow up where we bring in some folks from the marketplace so that we make sure we can represent that side of things as well. I
I
don't know,
agree.
did that do a good kind of covering of some of the open questions?
Yeah, and maybe some of these questions we can follow up after the webinar.